Ice or heat? This is a really common question, but it's not one I can answer directly for you, okay? Because that's something you're going to have to find out from your medical provider. You can Google it, acute injuries, ice is better sometimes. Maybe with arthritic conditions, they recommend heat. But let me just explain from a physiological perspective, something I've never heard before, but it just kind of dawned on me the other day, is when we're sitting and we're resting, our body cools down. And when we're active and moving, our body heats up. And so it makes sense from just a physiological perspective that if we ice while we're sitting, we're accelerating the cooling process. And then if we use movement, we get up and move around to warm the area that we just iced, then we're coupling the ice with normal physiological components. I hear this with people, patients, I'll say ice it, and then I've felt it myself, of course. I ice, and then I do a little exercise and move around a little bit to warm the area up, and I feel prolonged benefits and long pain relief. While on the other hand, we're going counter to our physiological response by sitting down and heating ourselves and putting a heat pack. It feels really good at the time, but then more times than not, I feel great while the heat pad is on, but as soon as I take it off, the area gets cold, and then the pain returns. And so it's kind of like we're flooding us with heat while we're resting, then we get up and move around, but comparatively to the heat we've provided ourselves with the artificial external heat pad, we feel cold and stiff. And so just something to consider if you want to maximize the results. Let's think of it in terms of like functional physiological mechanisms, just like functional fitness. When I teach people to not necessarily do isolated muscle movements that are counter to the health of the joint, we can think of it with the ice or heat as well. Hope that makes sense. And again, you're going to know what's best. Some people really like heat and it just feels good, and some people really like ice and it really feels good for them. And like I said, you can consult your doctor on the subject or anything, but just from a functional perspective, it just kind of clicked for me. It made sense from that perspective. So hope that helps, and thanks.